How does lens stiffening cause presbyopia? Have you ever wondered why it becomes harder to read small print as you get older? This common issue is known as presbyopia, and it primarily happens due to the stiffening of the crystalline lens inside your. The lens is responsible for changing shape to help you focus on objects at different distances, a process called accommodation. As we age, this lens loses its flexibility, making it difficult to focus on nearby objects. When we look at something close, the ciliary muscle in the eye contracts. This contraction reduces tension on the zonular fibers, which are tiny ligaments attached to the lens. As a result, the lens can become more curved, increasing its focusing power. However, with age, the lens undergoes structural changes that make it stiffer and less elastic. This means that even when the ciliary muscle works normally, the lens struggles to change shape effectively. Several factors contribute to this stiffening of the lens. One significant factor is the changes in the proteins that make up the lens fibers. The lens is largely composed of crystalline proteins, which help maintain its transparency and flexibility. As we age, these proteins can undergo chemical changes, such as aggregation and cross-linking, which lead to a harder lens. Another factor is the sclerosis of the lens nucleus. The nucleus, which is the central part of the lens, becomes denser and less deformable over time. This increased density contributes to the overall stiffness of the lens. Additionally, the lens capsule, which is the thin, elastic membrane surrounding the lens, loses its flexibility with age. This further limits the lens's ability to change shape when focusing. Interestingly, while the volume of the lens increases as we age, this alone does not explain the stiffening. Instead, restrictions in movement within the lens fibers and other molecular changes play a more crucial role in the loss of elasticity. As the lens becomes stiffer, the eye loses its ability to accommodate, which means it cannot focus on near objects as easily. This progressive loss of near vision is a normal part of aging and affects nearly everyone to some degree. Researchers are exploring various treatments to help reduce lens stiffness or restore its flexibility. For instance, techniques like femtosecond laser softening of the lens are being studied to improve accommodation in people with presbyopia. There are also pharmacologic approaches, such as certain eye drops, that aim to enhance near vision by targeting lens flexibility or pupil size, although they do not directly reverse lens stiffening. Understanding how lens stiffening leads to presbyopia is essential for eye health. While presbyopia is a distinct refractive condition, it is important to consider it alongside other eye diseases, such as glaucoma and macular degeneration. As we age, maintaining good eye health becomes increasingly important, and recognizing the changes in our lenses is a key part of that journey. If you have concerns about your vision, it is always best to consult with a healthcare professional for personalized advice.